Appendicitis is an inflammation of the appendix. The appendix is a finger-shaped pouch that sticks out from the colon on the lower right side of the belly, also called the abdomen. Acute appendicitis is a prevalent cause of sudden abdominal pain, particularly affecting children and young adults, with rare occurrences in infants and older individuals. Younger children are at higher risk of perforation, ranging from 50% to 85%. The appendix can be found in various locations, including retro-caecal, pelvic, para-caecal, sub-caecal, pre-ileal, and post-ileal positions. Obstruction of the lumen is the primary cause of appendicitis, with common culprits such as lymphoid hyperplasia, which is more common in children. This is due to Crohn's disease and infections such as Gastroenteritis, Ameobiasis, respiratory infections, Measles, Mononucleosis, faecaliths, which is more common in adults. Clinical presentation typically involves central abdominal pain that migrates to the right iliac fossa, accompanied by symptoms like anorexia, nausea, vomiting, slight fever, and tenderness in the right iliac fossa. Physical examination may reveal signs such as rebound tenderness, Rovsing sign, obturator sign, and psoas sign that hip will be kept flexed position. Different locations of the appendix may present with varying clinical features, such as silent symptoms with a retro-caecal appendix, diarrhea with a pelvic appendix, signs of peritonitis with a perforated appendix. Late or partially treated appendicitis may result in the formation of an appendicular mass or abscess, which requires careful monitoring and, in some cases, additional interventions. Diagnostic investigations include a full blood count showing neutrophil leukocytosis, urinalysis, C-reactive protein levels, ultrasound, contrast CT scan, and urine beta HCG in females of childbearing age. Treatment usually involves appendectomy and intravenous antibiotics. Conservative management may be considered in cases of appendicular mass formation, with close monitoring of vital signs and mass size. Laparotomy is indicated for a perforated appendix, while incision and drainage are performed for an appendicular abscess. Thank you for watching NextMeds. Please like and subscribe for daily videos about health, nutrition, and diseases.